There has been a lot of talk in the media about allowing minors to medically transition. People will say things like protect trans kids as if there is an imminent need for a 13-year-old girl who was otherwise healthy to have a double mastectomy. There are people like myself who are against children transitioning, and when I look at children like Shiloh Jolie-Pitt, it reinforces in my mind why minors should not be allowed to medically transition. Hello everyone. If you are a new viewer, welcome. If you are a returning viewer, welcome back. If this is your second, third, fourth time watching one of my videos and you are not yet subscribed, we already go together. Just make it official and hit that subscribe button. All right? Wife me up. But let's talk about Shiloh Jolie-Pitt. I have to keep reminding myself to not say Pitts.
That's not my name.
I don't know why I keep thinking her last name is Pitts. Jolie-Pitt. Shiloh is the daughter of Angelina Jolie and Brad Pitt. This child is absolutely gorgeous. This is completely off topic, but this is a very good looking child, okay? She's very pretty. She has all of the best features from Angelina Jolie, all of the best features from Brad Pitt. She's such a beautiful young girl, and for a long time, she presented like a boy. As of the making of this video, she is currently 17 years old, but from a young age, Shiloh was very unique. In a 2008 interview with Oprah, Brad Pitt revealed that at the age of 2, Shiloh preferred to be called John. Quote, "She only wants to be called John or Peter, so it's a Peter Pan thing. So we've got to call her John. Shy, do you want John? I'm John." And then I'll say, "John, would you like some orange juice?" And she goes, "No." So it's just the kind of stuff that's cute to parents and is probably really obnoxious to other people. And in a 2010 Vanity Fair interview, Angelina Jolie had this to say about Shiloh. "She wants to be a boy, so we had to cut her hair. She likes to wear boys everything. She thinks she's one of the brothers." Over the years, Brad Pitt and Angelina Jolie were supportive of their daughter. They supported her desire to be called John, something which she eventually outgrew, and as a teenager, she now goes by her name, Shiloh. Her parents also recognized her biological sex as a female, but allowed her to dress in the clothes she felt comfortable in and allowed her to style her hair as she desired. They never once turned her into a trans trophy or a non-binary icon. They allowed her to organically explore who she was as a person. As a child, she often chose to wear suits and keep her hair short, resembling a young boy. And as a teenager, she seems to be embracing her femininity more and more, and is now simply an androgynous young lady, not unlike her mother, who also went through that fashion phase. I think Shiloh is a prime example of why minors to medically transition, especially if you take into consideration that studies show that 4 out of 5 kids who question their gender will eventually accept their bodies if no medical intervention is carried out. Children are still learning who they are, and medically transitioning is not something that can be easily undone, and it also comes with undesired side effects like lower bone density and fertility issues.
I stayed on testosterone for 5.5 years. My kidneys and my liver began to fail. I was completely jaundiced, and I started urinating blood and vomiting blood. And I couldn't even stand up most days. I became very sick, and my doctor said I needed to be hospitalized. She said, before being hospitalized, why don't we take the testosterone out of the equation and see if that helps? So I did, and it did. It helped. The jaundice eventually went away. My health has been severely affected by this. Yeah. I have had endometriosis, vaginal atrophy that's so severe that it continues to tear and bleed. I'm now so low on estrogen, my doctor says it's lower than a woman going through menopause. So I actually now permanently have to go on supplemental estrogen.
The very first medical intervention I ever had was a double mastectomy at 16. And then a few months later, I was put on testosterone. I'm now 21, and I will live with the impacts of that so-called care for the rest of my life. In the past 4 or 5 months, I have watched as my body has fallen apart in front of me. My joints constantly hurting, my vocal cords aching, watching as parts of me atrophy away before my very eyes. And yet at 16, they looked me in the eyes and they told me this was care.
Another reason that I am strongly against allowing minors to transition is because there is no standardized testing, no standardized assessment that a clinician can perform to diagnose someone with gender dysphoria. There are tests that they have to diagnose people with borderline personality disorder, histrionic personality disorder, dissociative identity disorder, so many other disorders. There are standardized assessments that clinicians can perform to see if a person truly is suffering with that disorder or whether they are malingering, which is a scientific term for faking it. Those type of tests do not exist when it comes to gender dysphoria. Gender dysphoria is pretty much like one of the only disorders where it is a self-diagnosis. A doctor will sit down with someone who believes they have gender dysphoria, they will listen to what they have to say, and they will affirm them. And if you don't believe me, there are plenty of detransitioners who will tell you the same thing.
I transitioned around the age of 18, 19. I would say within the last year and a half, that's when I've had thoughts of regrets to transition back as a male. The clinic that I had gone to, the therapist that I got, she told me that she could get me all the paperwork to transition that after my first session.
After your first session, did you just go and say, I think that I'm a woman?
Exactly what she said is that her clinic, where she was working at, they're not trying to be gatekeepers for us, for anyone who says they're transgender, and they try to get them their paperwork quickly.
I mean, these are medical professionals, right?
Yes.
But they're taking your word for it.
Yes.
And what was the criteria that she used to say, yeah, I agree, right, that you actually are transgender?
I believe at the time, I honestly just told her I was transgender, that I wanted to transition from male to female, that I didn't feel comfortable being as a boy, and she said, that's good enough.
It was scarily easy to do because I had just called a therapist and I had scheduled one appointment, for like a 30-minute session to talk about it. And I essentially walked in, I said, I identify as transgender and I want to get top surgery. And we chatted for a bit, maybe for half an hour. And at the end of the session, she wrote me an approval letter to send to my insurance. And then I got approved just like that.
When you first started, you went in, you said to Planned Parenthood, they gave you testosterone immediately.
Yeah, I essentially just made a phone call and said, I want to transition, and it was immediately given. I got a prescription and went to pick it up like a week later.
Did they ask you questions? Did they do any psychological testing? Did they ask you why? What was your motive?
It was completely self-diagnosed.
You said, I want testosterone, they gave it to you.
Yeah, I had confused, because I had become uncomfortable with how society had seen me as a woman sexually. So I didn't actually have gender dysphoria. I had just confused myself into thinking that I did.
And forget transitioners, there are doctors who will tell you the same thing. Dr. Natalia Zikarieva is a clinical psychologist who specializes in transgendered and non-binary adults. She is very pro-transition. She has written books. She makes videos on YouTube and TikTok discussing gender dysphoria, does speaking engagements. She is very active in the movement, and I stumbled across this video where she discusses how she diagnoses her patients with gender dysphoria.
So in my opinion, to get a diagnosis of gender dysphoria, there's two ways to go about it. One, you go to mental health providers such as myself, either psychologist, mental health therapist, counselor, or you go to a psychiatrist and they do an assessment. If you look at the DSM criteria for gender dysphoria, it is very, very subjective, based on your subjective experience toward your gender. And that's the key here. There is no psychological test a person can give you in order to diagnose gender dysphoria. In my opinion, it just doesn't exist. All it is just really taking a very detailed history. So that's one way you can get diagnosis of gender dysphoria. Second way you can get diagnosis of gender dysphoria is when you go to any informed consent clinics or informed consent practices where a medical doctor, in this case, gives you a diagnosis of gender dysphoria in order to prescribe you hormones. Because if they prescribe you hormones, that means they have to put down diagnosis of gender dysphoria. So those are the two ways that you can get the diagnosis: mental health provider for assessment, or you go and you see a medical provider through informed consent model and they put down the diagnosis of gender dysphoria for you.
Imagine you went to a doctor and you told them that you think you have the rarest form of cancer because sometimes you feel tired and cold. And the doctor said to you, okay, yeah, it sounds about right. And they started giving you chemotherapy based off of those self described symptoms. That's ridiculous. That's asinine. And that is how gender dysphoria is diagnosed. And that is the biggest reason why I am against transitioning children, especially when you consider the fact that many of the children who identify as trans and non-binary and seek out medical intervention don't actually have gender dysphoria, but instead they are suffering from other forms of major.
I agree with you. And what were the things that you lost sleep over, Hannah?
Well, that potentially very vulnerable children might have been harmed. And, documents from the clinic, transcripts of interviews that JID's clinicians gave to the medical director across 2018, they were deeply upsetting. Those clinicians talked about the young people they were seeing, not all of them, but some being some of the most vulnerable children they've ever seen and being in really quite a terrible state. And in some cases, and again, not very many, but in some cases they were referred for quite a major physical intervention after an hour or two, or even 3 or 4, which was allowed. But the levels of trauma that some of those children had suffered prior to that didn't seem to be being explored, it's upsetting, and I became a mum in 2016 and it just changes your outlook, I suppose.
So let's explore a little bit what those terms mean. What does it mean, major trauma, and what do major interventions mean?
So trauma, some of these young people had suffered physical or sexual abuse. Some had lost a parent very young through bereavement or, had suffered family breakdown. A small but sizable proportion were living in care, which sort of implies that there had been the difficult circumstances leading up to that. Some were living in quite a risky way in terms of their sexual behaviour. Those are all traumatic. Some had parents that were abusing alcohol or drugs or who had mental breakdown, and that's not those parents' fault, but that's quite traumatic for a child to grow up in that living environment as well. So in terms of major interventions, I'm talking about the first intervention and sort of the primary one that JIDS would refer young people for is colloquially puberty blockers. And it would seem from the very poor but in limited data that we have that once on puberty blockers, the vast majority of those young people would then go on to hormones, so either synthetic testosterone or estrogen, depending on your sex. With those came lots of physical potential risks, particularly if you block puberty early and you go straight onto hormones, you will be sterile, for example. Not so much if you go on later, then there's chances to preserve fertility, but all sorts of things. And to even those who are very happy as trans adults, and for them it was the right and only path, they will tell you that it's not always easy living as a trans man or woman. You have to take medication for the rest of your life. If you medically transition, you may have several intrusive surgeries. So to go through that and it not be the right path is awful.
If you agree with me that children should not be allowed to medically transition, please make sure you hit the like button on this video. Not only does it help support my channel, but it also helps this video in the algorithm. If you are not yet subscribed to my channel, please don't forget to hit the subscribe button. If you would like to follow me on social media, you can find me at NissCee.Social on Instagram. If you would like to support my channel monetarily, I do have a Patreon account, and the link for that is in the description box down below. I would like to say thank you to the handful of people who are currently supporting me on Patreon. I really greatly appreciate your support. Sometimes when I do topics like this, actually oftentimes, they do get demonetized. So I appreciate all of the support that you guys give me. Thank you. I have nothing else that I want to add, but I do have, and if you liked this video and you would like to see more content like this, I do have 2 more videos that I think you will enjoy in the end cards. I will see you guys in the next one. Take care. Bye.